to think a little bit more about treatment strategies that are used for KRAS mutant lung cancer, besides locally directed treatments such as surgery or radiation, which address um, specific tumors. A medical oncologist generally thinks about systemic therapies or chemotherapies. And by that, I mean treatments that are given either orally or intravenously that go throughout the body. Specifically, when talking about chemotherapies, we are usually talking about an IV medicine, shown in the blue circle, that's given to kill rapidly dividing cancer cells. And this is a list of common chemotherapies that are considered in KRAS mutant lung cancer. And they're usually given once every 3 weeks, but can be given every other week or even weekly. The middle row, which says immunotherapy, when we talk about that, we're usually referring to a class of medicines called immune checkpoint inhibitors or PD-1 and PD-L1, anti-PD-1, anti-PD-L1 drugs. These medicines are also given intravenously and are listed below. And include the following. Actually, the last drug there, ipilimumab, is a CTLA4 targeting medicine, but they're all immune checkpoint medicines. And what these generally do is your immune system, which is always surveilling for abnormal cells, actually take out cancer cells. And so these medicines enhance the ability of the immune system to identify and destroy cancer cells. And they specifically affect the PD-1, PD-L1 pathway or CTLA4 pathway that's located in that interaction between the cancer targeting CD8 T cell and your own cancer cells. And so you can think of it as almost pulling off the invisibility cloak that cancer cells use to hide from the immune system to go after the cancer cells. And these are guided by generally another biomarker known as PD-L1. Also, targeted therapies are used in KRAS mutant lung cancer. One class given intravenously are called anti-VEGF medicines. These target blood vessel development around the tumor and are bevacizumab and ramucirumab. And then the most exciting area of KRAS mutant lung cancer are these new emerging targeted therapies, which actually go after the mutant KRAS protein itself. And now we have two FDA accelerated approval medicines in 2021 and 2022, sotorasib and adagrasib for KRAS G12C. Now that we have some breakthroughs in KRAS lung cancer, there actually are many clinical trials that are currently active and enrolling patients with both KRAS G12C as well as non-KRAS G12C, like KRAS G12D lung cancers. Additionally, there are some co-occurring mutations that happen with KRAS lung cancer. I've listed 4 of them here: MTAP, STK11, KEAP1, and SMARCA4 that also have promising clinical trial compounds for individuals with KRAS mutant lung cancer. So there's actually quite a bit of excitement currently in this field. So to summarize, this cancer affects about a quarter of those with non-small cell lung cancer. You really need to identify the mutation, and not just that there's a mutation KRAS, but what is the specific amino acid that has been changed. This takes some time. So a team of doctors and staff work together to make this diagnosis. And this is actually quite important to get it right, to start personalized treatment, and can be repeated in the future.